paid for any sort of healthcare?
Yes.
Yes.
What? Have you ever paid for any sort of healthcare?
No, never.
Have you ever paid for prescriptions?
No.
Do you think Canada's healthcare is truly free?
For some people.
How many times a year do you go to the doctor?
For sure once a year.
Do you pay to go see the doctor?
No.
No. Why don't you have to pay to go see a doctor?
Why? Because Saskatchewan has Saskatchewan have a group health insurance, I think, or a group. We don't pay here in Saskatchewan to see the doctor.
Canada is known for many different things. Hockey, our ability to consume beer, and yes, our free healthcare. Canadians leave the doctor's office without opening their wallets all the time. But what many people may not realize is that doctor checking out your boo-boo on your arm costs more than you think.
We all know nothing in this world is exactly free, so what do Canadians pay for healthcare? According to Statistics Canada, in 2014, Canadians spent approximately $141 billion on healthcare. To find out what each Canadian paid on average, that number was divided by the population at the time. This concluded each of us would have paid approximately $4,000 for healthcare that year. However, not every Canadian pays an equal amount in taxes, because the amount we pay is determined by our income. Dependents and children are not responsible for paying taxes, and high-income earners are required to pay more than low-income earners. To account for this, the study broke average Canadian families into common income groups, concluding that Canada's poorest families pay less than $500 a year for healthcare, while the wealthiest earners pay upwards of $37,000 a year. So, not only are Canadians indirectly paying thousands, and for some, tens of thousands of dollars per year into our healthcare system, according to a Fraser Institute report, these costs are on the rise. Healthcare insurance costs have nearly doubled in the last decade and are increasing at a rate of more than 1.5 times the average Canadian income.
Healthcare is something that is never usually on the forefront of people's minds when they are making their monthly budget. You pay your taxes anyways, and you never really see the money you pay into your health coverage at work. So why is this myth so troubling? Healthcare in Canada is covered by our hard-earned money in a way that we never physically spend it ourselves. Therefore, it's a service that is a lot easier to abuse. You have a stomach ache, you go to the hospital. A cough that started a couple of days ago, you go to the doctor. When everyone has the mentality that no money leaves their pockets for these visits, these places then become overcrowded, which leads to overworked staff, which leads to longer wait times. You get the picture.
Imagine you are sitting in a doctor's office with your crying 2-year-old who has had a fever for the last 12 hours. You're tired, your child is sick and upset, and when you look around the room, what do you see? There is a man sitting across from you who has holes in his clothes, an Aboriginal woman waiting with her 4 children. Maybe the thought that goes through your head is it people like this that makes receiving healthcare so difficult? Or maybe even, I pay lots to taxes for what? To be waiting for hours on end with people who don't spend nearly as much as I do.
In the Carmen Rios article, Debunking the Pull Yourself Up from the Bootstraps myth, she comments on lower-class people and how they're seen as singular people who have gotten themselves into sticky and unfortunate situations, and that, sadly, makes it easier for other people to disassociate from their problems and decline opportunities to help them. It is easier to point fingers and blame those who may not contribute as much to Canada's healthcare. Of course it is, but that doesn't make it right. We are oppressing people in society that deserve access to healthcare just as much as anyone else. She also says, it's easy to tell ourselves that we are different from the poor and the homeless by blaming their poverty on them. It's harder to ask ourselves what kind of support mechanism could help them to get where we are, and what we could do or give up to make that happen. We would complicate this narrative by suggesting a support mechanism, as Carmen Rios mentions in her writing. We wonder if there was more education and support for people about proper diet and nutrition, would it lessen the strain on the healthcare system? When people are looking after their health in the best capacity that they know how, it may lead to less doctor's visits. This includes everyone. Canadians need to start emphasizing on health and not just healthcare. Putting an emphasis on prevention, we know, will only get us so far. We think it's a matter of education and willingness to use outside resources. This includes educating people on how our health system works, so people understand how the overuse of these services are effectively creating an overworked system. There are services intact today that offer medical support to families, such as the Healthline, family support centers, nutritionists, and local community food banks. As a society, it is important that we are aware of these services, despite our social standing. What would happen if higher-earning individuals gave up a fraction of their privilege, in the form of donations, volunteering, or even just guiding people in the right direction? Canadian healthcare, although not exactly free, is made available for our great country's citizens. It may have flaws and not be perfect, but Canada wouldn't run without it. Thanks for watching.